Um, Hi everyone, welcome to this session. I'm Maryam Asif. I'm originally from Pakistan and I did my med school there. I did my pathology residency from University of Chicago, then did a fellowship in transfusion medicine and blood banking from Seattle. I am currently faculty at University of Washington in Seattle. I do mostly transfusion medicine, hematology, and coag. Prior to joining UW, I was faculty at UC Davis, and I was associate program director for pathology residency program. This is something very close to my heart. I know being an IMG myself, I feel like we we don't find enough of training or material to go over while we're preparing for these residency interviews. So today we're gonna try and talk about some interviewing tips for residency candidates and take some questions about it. So I do not have any conflict of interest to disclose for this presentation. I do have a disclaimer that this is tailored towards IMGs, but it will benefit anyone interested in doing interviews for residency. The content that I will be presenting is my personal views and experiences, and it's not any representation of official policies or views from UW or any affiliated institution. And it's solely for educational purpose for attendees to benefit from what I think might be my own experience sharing with you over the years. Okay, I do have this first slide where I wanted to get a sense of which residency specialty did people who are joining have applied to or are planning to apply to. So let's see if this works. You can just take out your phone and scan this QR code from the screen, and it will show up on your phone, and we can see if we can have some poll here. Okay, so anyone needs the QR code, I can share it again here. It's anonymous, so you don't have to worry if anyone would know. So I just want to see how the room looks like where people are applying. We have pathology so far. Uh, okay, I guess we did get we got some responses, but it's interesting. It's not showing up all of them. But we have a lot of people in applying for pathology uh, over here. That's wonderful. Okay, so let's move on. As an outline, I'll be discussing, very basics on preparation for interview and what are the common questions that you should be expecting, what to practice and how to practice effective communication during an interview, highlight some of the unique strength and features that IMGs might be facing, preparing questions for interviewer, because most of the time when I'm interviewing, I do ask if you have any questions for me. And sometimes it is more interactive if you have questions for the interviewer. Some technology preparation, building confidence around interview stress, and reflecting and following up post-interview, and some additional tools for self-awareness. Okay, so why interview skills matter? It's very important to understand that if you have received an interview from a program, you have actually pass the first pass where they go through multiple applications and select people whom they want to interview. And even if they have 4 seats and let's say they're interviewing 40 candidates for it, you have made it to that list already. So it's very important that you have those skills now, because why people interview, it's just 20 minutes or 30 minutes interaction with one person at a time, and sometimes in a group setting, that small brief interaction, how much can you know about a person, and do you really want them to join your program because you're going to be with them for next 3 or 4 years. So that's why getting an interview is the first thing, but then why it's very important to have that interview, why it's very important to have the skills to do that. And some unique challenges that IMGs do face is language barrier, culture differences, unfamiliarity with US medical system. So trying to familiarize yourself with all those can be very helpful. One thing I always tell that I had a big cultural difference where I was Dr. Maryam in Pakistan. Over here, I'm Dr. Asif. So if anyone is addressing anyone over here, it's mostly you go by their last name first. And if you don't know them, especially, or even if you start knowing them, unless they feel comfortable or they say, oh, you can call me Maryam, that's fine. You can call them by their first name, but mostly it's Doctor last name. The goal of the talk is to equip you guys with some of the strategies and navigate through some of the common questions that can come up. So preparing for interview, that can be very stressful. And most of the time when you're preparing it, what you have to start from is the research about the program. What program you get an interview from, go on their website, read about them very carefully. They should have a lot of detail sometimes available on their website. Focus on the specialty that you're applying and see how and what is unique about them. Gather all that information from their website, or if you have alumni or residents. I can tell you when I was applying for residency, the interviews were in person, but at that time I searched about a program where I got an interview and somebody talked about the whole interview experience on Reddit. And it was so helpful because when I went to that interview, I already knew and I wasn't caught off guard because I read that online where somebody shared it on some sort of forum. So search online, you'll be surprised how much information you can find online about a residency program which has invited you for an interview. Reviewing your own application. So knowing your CV inside out, your personal statement and achievement is very important. If you have anything in your CV that you have mentioned as, oh, I did a talk on XYZ, you may be talking to a person who's expert in that, and you really want to know what you actually did, because you can get caught into a very difficult situation where if someone is expert in that specialty that you have done talk in, they would want to talk about it with you. And knowing your achievement is very important too, because sometimes if you're coming from different countries or different background, they might not know what first division means or what a different award that you got means to them. So they might want to know more about it. Be ready to discuss any specific experiences. If you're, for example, I was applying in pathology, but I did internal medicine internship year. So I was asked about, oh, you did internal medicine, but now you're applying in pathology. So why are you doing that? Do you also feel like you want to apply in internal medicine as well? Or why are you driven towards pathology? And then understand the US residency culture. I already mentioned about the name, but then know whom you're talking to. If you're talking, most of the time, the residency programs, it's program director, then associate program director, a program coordinator, all the residents, fellow. So know whom you're talking to. There can be faculty who are interviewing you. They may or may not be part of the residency committee, which comprises of program director and associate program director and some additional faculty who are included in that. Versus it can be just a faculty who took out time to do the interview, but they all have some sort of parameter that they can put response and evaluation after the interview for you. But knowing whom you're interviewing with, if it's a resident, if it's the chief resident, if it's a fellow, if it's attending, and what level the attending is at, can be very helpful for you to tailor your questions. Um, Definitely professionalism and communication style matters a lot. How you're communicating and how you're expressing yourself is very important. So I have this poll. Let's see if this works. We can go on this one and start the poll. Let's go back and see the QR code. So I wanted to see how many of you feel prepared for the residency interview, because I know it can be a very stressful process, and a lot of you may already have started preparing for it or have tried, you know, some mock interviews or have done some interviews already. We're towards the end of the October, so a lot of interviews have started already. So if you have done some, how is your experience? What do you think you feel? And most of the responses we are receiving is they feel somewhat prepared but need more practice. Okay. Thank you so much for responding. And that's where practice is very important. I completely agree. And a lot of times it's interesting, even when you practice a lot, you might not feel prepared until the last minute when you're actually interviewing with the program. But it's okay to feel that overwhelming uh, feelings that you have. So common questions. I try to divide them into how actually questions work when we're interviewing, and most of the time we are focused on each of these sections separately, actually. And most of the time there can be some sort of evaluation and feedback for the interviewer to fill for the candidate based on all this. So starting with the first one, personal information. So crafting a very engaging "tell me about yourself" is very important. Um, for me, I'll tell you, I wrote down what I want to say and started practicing it very early on, because sometimes you want to say a few things, but then if you've not practiced, you'll miss one part or the other. And most of the time, what you want to include and tell me about yourself is what background you're coming from, what are the relevant experiences you want the interviewer to know about you. What's your personal story? Tell it like a storytelling, and it's your story to tell, and it's mostly very unique from other people. Keep it concise and focused. If you write it down and try to practice it, and you'll see it mostly goes between 1 to 2 minutes and maybe up to 3 minutes. But that's your time. It's the beginning of an interview where most of the time the interviewer wants to know about yourself, and they give you very easily the first time of coming up with what you want to tell them about yourself. Be authentic. You wherever you're coming from. I always tell that I'm from Pakistan, and I own that I am immigrant, and I cannot change that. It's my identity. And even if I'm US national now, it still does not change that I was born and raised in Pakistan, and that makes me different from people over here. So I always own that, and I go back to that roots and tell that and start with it. And do end up with some of your hobbies or interest. I've seen a lot of people tell about themselves, and mostly it's like, for example, if I'm telling about myself, of course, for this presentation, I started off with an introduction. I didn't say what my hobby or interest are, but then you can, when you're interviewing, the interviewer do want to know you as a person that's going to be joining a residency program. So if you end with, and I love to travel, or I love cooking, and my hobbies include XYZ, it's perfectly fine to include that. And I would highly, highly recommend write down your tell me about yourself, and talk about it to someone else. See how it goes. See how you want to tailor and tweak that paragraph for your own self, how it feels very unique to you, and what you want to include in that information and what you want to exclude. Most of the time know that if you're an international medical graduate, they would not know, what kind of college you're coming from, or how good of a student you were. You can't say mostly, for professionalism and communication purpose, you're not like, oh, I'm coming from the top university in Pakistan. I mostly don't say that. But I do say when I'm introducing that, okay, I'm from Pakistan and I did complete internship here because that's important, my clinical experience. I did 1 year of clinical internship in Pakistan. And then I was teaching as a clinical instructor in medical college to in pathology, third and fourth year students. So that is a good personal experience that I want to tell. About personal story, it can be your own personal story. Mostly it's like, oh, I moved to US, I want to move to US, or currently what I'm doing. You can tweak that and come back to starting from your background and coming back to your present, what you're doing right now. Right now, I'm working on a project on XYZ with that person or with that institution, and it's very interesting. And they might tailor you might be able to drive the conversation from just the first question, tell me about yourselves, to something which you want to talk about. Okay. Next is the behavioral questions. So those are sometimes people think, oh, these are very simple ones, and I'll go, extempore speech right on the spot when I'm asked about it, and I'll do fine, which I do not recommend doing. I think it's very important to prepare for some of these situations and make up your mind what you want to present on or what you want to talk on. And most of the time, for example, we say, tell me about a time you faced a challenge in a clinical setting and how did you handle it? So you want to have a very fine situation that you're dealing with, and then a task or action that happened during that time and what was the result of it. If these are some examples, tell me about when you made a mistake. And now this one is very tricky. It's a behavior question, but at the same time, it's very tricky. What kind of mistake you want to put out that does not show you as someone who has done something wrong. It should be something which is a mistake where you learned out of it, but it wasn't something where patient care was affected or teamwork was affected. It's something, it's very tricky to choose, a weakness which can also be a strength. And people do that very easily. Uh, for example, I used to tell about a mistake where I switched a call with someone, but I did not put it on the schedule. But when it came to the time of the other person, they did not hold the end of their bargain. Now, the mistake lies with me over here because now suddenly I have to cover two different clinical services where I thought the other person would cover me on the other half. And I learned out of it. Of course, no patient was harmed and nothing bad happened, but I learned out of it that, okay, if you're switching a call with someone, you have to put it on a schedule and make sure that it's equally, communicated on both sides and the loop is closed. Otherwise, you cannot leave a service without another physician who's not there and who's supposed to be there. Tell about disagreement that you had with a colleague or superior and how did you handle it? Uh, you went above and beyond for a patient or colleague, and what motivated you and how did that end up? It can be you worked in a team, what was your role, and how did you perform as a team player? And it can be something, how do you manage multiple responsibilities or deadlines? Know that a lot of these, they want, if I'm asking a question, okay, how do you manage multiple responsibilities and deadline? What did you prioritize? I want to know that that person is telling me, a good situation and explaining what their role was, even in the team, what their role was. Or I was the lead, or I was not the lead, just the member of the team, but the task that was given to me was XYZ. So be very clear on what you're telling the situation and what was actually happening. Because imagine it's very important how you're drafting drafting your story, because I am almost at that time and you're telling me, imagining you going through that and what other peoples are playing role in. There are a few buzzwords sometimes when somebody is asking, how do you, if you have multiple responsibilities and deadlines to meet, what would you do? So prioritizing, triage, I would triage, I would have, triage is a buzzword that's very important. Sometimes even in pathology, if you think of a lot of cases, I would triage which cases need my attention first and which can wait. And then call for help. Sometimes it's important, we wanna know if you know your boundaries and you are gonna call for help. if you have too much work. And knowing that is also equally important, as much as it's important to manage your own workload. Okay. So those kind of things are something that an interviewer is looking for. So what an interviewer is aiming to learn about a candidate through all these behavioral questions is how someone navigates through conflict or stress. Okay, what's the emotional intelligence? So emotional intelligence is what you are self-aware of in a situation, what you were feeling or what you were going through at that time, but also reflecting on what other people are going through and reflecting. And how did you manage that? Did you just, for example, I was giving example that I switched a call with someone, but she did not hold the end of the bargain of her side. So I went to her actually, and I asked her, I'm like, you said you're gonna do this call if I switch with you, but now you're not doing it. And she's like, no, I'm extremely sorry. I thought I'll be able to fit it in, but I'm on call that day that you're asking me to switch to. Is there any other day that you need coverage? And I did not. I was like, this is the only day I needed it, and I thought you were gonna cover it. But that emotional intelligence of knowing, yes, you were frustrated and sad in the moment, but at the same time, you wanted to know what other people are thinking or doing. Same goes for a teamwork. If you're going through a teamwork, what your thought process was in the moment is very important. How you communicated things. Communication skills also play a role in how you're telling the respond to any behavioral question. Are you adaptable to challenging situation? Do you hold yourself accountable and take the integrity of the situation? And are you able to manage time if you're under stress? And are you a team player? And how you follow professionalism? So a lot of hodgepodge of a lot of things, and based on what question interviewer is asking, it can be very much that they're trying to navigate an evaluation or feedback about you based on one of these. Now, every program can have it very differently. I've I would say sometimes attendings have questions divided among them, and one would be evaluating you on one thing, and other would be evaluating on other thing. Sometimes it's like, oh, it's a complete overall evaluation for each individual, and they're not communicating with each other. It's just a feedback that each faculty who is interviewing would fill up. Um, Same goes for residents. If their residents in the program are interviewing you on other things, they're also sometimes mostly doing individual feedback, and then they come together and maybe talking about overall experience they had with you. Okay. Moving on to clinical scenario questions. Now, these are the ones where most of the time they are thinking that you're going to be coming as a resident, and whatever clinical scenario you're telling or they're giving you, how your decision-making skills are in that, uh, you're going to be showing some resilience, dependability, and ethics based on that. Most of the time, I always ask, tell me about an interesting case you saw recently or in the past. But sometimes I know in interviewer, they may have a very targeted question for you, and they can ask that, okay, it's a scenario where XYZ is diagnosed, and you have to call the team to tell them how would you handle that. So think of the situation just like a resident would. And if you have, even if you're a fresh graduate coming out, you have done clinical rotations and you have observed residents handling calls. So think of what a resident would do in that situation. And that's what they're trying to see. How would you fit in that program, and how would you respond to a clinical situation if put in that? They may have follow-up questions based on your responses, so be ready for that. And most of the time, these are straightforward and not as difficult as I find behavioral questions. Difficult questions. So difficult questions can be based on your gap in education, any low scores or weaknesses that they might pick up on your personal statement or your CV. Now, know one thing, everyone is different. And the one thing I can tell you as an interviewer, as a faculty, that we are not allowed to ask certain questions. I'm not allowed to ask about a visa status or marital status or kids or things like that from someone from a candidate. I'm not allowed to. But you as a candidate, or you who's interviewing with someone have the privilege or the the authority to decide what you want to disclose about yourself. Okay. And it can be you want to explain how things happen in a story. They would not know why you have certain things or not. They might not even ask you. So if you want to disclose that, it's up to you. Sometimes people do vaguely disclose things in their personal statement, so that's when you can ask about it. But most of the time, for example, when I was applying for residency, I was married, I had a kid, and I would tell upfront because I have a family and I'm ready to move. My daughter is this age and my husband is working in XYZ and he'll move with me. So all that I chose to disclose that information in the moment. But let's say if you have someone with some medical issue that they're dealing with and they don't want to disclose about it, and it's perfectly fine not to disclose about it. Nobody can ask you if you have a medical issue or if you have a visa issue, because that's not something that will affect your work, that will not affect your professionalism or your performance as a resident, so you don't want to disclose that. But mm, so you choose what you want to disclose. Sometimes other person cannot even ask you few of these difficult questions that you might think would be common. Be prepared if you have gaps in training or experience. Be honest about them, and if somebody focuses on that or address them, just tell them what you're doing right now or how you're covering it. You're doing, for example, if you're doing clinical observership in US, you're doing some research experience. And if you have a gap, be authentic about it. That's what they're looking for. I had a gap and nobody asked me actually, but I would disclose myself. I moved from Pakistan to US, and during the move, I had no family. I moved to new country and I started from scratch. So that's where I was sort of explaining my gap, because I'm moving and I'm new mom and in new country and a lot of things are happening. So people do understand this. But if I chose not to disclose that, other person I would think would not know how my CV gaps are explained and what to ask, and maybe they don't even want to ask if I why do I have gap. So it's up to you if you want to disclose that and how you want to disclose it. Skills gained from practice in diverse healthcare settings. I always tell it, I've done internal medicine internship back in Pakistan, and it was a very resource limited area. It was a tertiary care hospital. How I have done hands-on a lot of patient care that I may not even get a chance in US. And yes, I am applying in pathology because I am interested in pathology, but that experience gives me a very strong background and platform to start off from, because I know what's happening on the clinical side. So things like that, what's unique to you. If somebody asks about your weakness or they pick up something from your CV, which might look like a weakness, uh, do respond to it very carefully and show it as a learning opportunity. Gap is not a weakness if you have a valid reason, if you were caring for a loved one or a family member, if you're moving somewhere, if you had a health issue that you don't want to explain, you can just say, oh, I had a health issue during that time I was dealing with, but I'm perfectly fine now, and I don't have that anymore, or I'm not dealing with that now, and I rose above it and came to this level. Okay, questions for the interviewer. Now, this is very important because I always like if someone has question for me, and I can understand if one candidate is interviewing, let's say with 4 or 5 people, they may run out of questions. So you have to write questions about for the interview that you want to ask. Uh, Most of the time, asking about the information that is already in the website, I would recommend to avoid that, because that's your homework. If you have searched a website and they have, they have stated on their website, oh, we have XYZ fellowship, asking for that in an interview may not benefit you or the interviewer. It's just that you're trying to use that 20 minutes of time very wisely, and you want to draft your question for the interviewer very nicely. So if you're know that whom you're talking to. If you're talking to a resident, ask about how their typical day looks like. What do they do for fun? How do they celebrate something, or uh, how do they manage backups or unexpected leaves, things like that. If you're talking to an attending about something, ask something very specific about the program. Um, or about the city. So I had this question from a candidate once, which I really liked. She asked me, well, you're in Seattle, tell me something you really like about Seattle and something you don't like about Seattle. And I was like, oh, this is really nice question because I can sense how she really wanted to be in Seattle and she wanted to know about the city more. And most of the time the interviews are remote these days. About the program, I have had questions about AP. So I'll tell you, I can tell if I'm a CP faculty in transfusion medicine, hematology, coag, and someone is asking me about breast pathology, that may not be something I have an answer to. So that's why knowing your interviewer is very important. You do get that full schedule ahead of time and search on the people that you're going to be talking to. Sometimes people go and see what I've researched on or what my interests are, and they talk exactly or mostly tailored towards that. Oh, I'm interested in transfusion medicine and you're a transfusion medicine faculty, and I see there is a fellowship. So they would go into more depth and ask a question related to that fellowship or related to transfusion medicine. Ask about program improvement. Now, this is a careful question, but it's a really good question if you craft it nicely. I had this question when I was interviewing because it helped me actually know about program more in depth because, of course, if you got selected for an interview, the program wants to take you, okay? Know that. Now, if you want to go in a program, you also want to know about the program more in depth before joining that, because it goes both ways. Yes, they're going to be having you for 3-4 years with them, and you're going to be also working there for 3-4 years. So you do want to know about them. So I had this question once, and I've asked this in multiple interviews when I was interviewing, that how you're crafting this question is very important. For me, I crafted it as I see that your program is prestigious and they have XYZ strength, but is there anything you would change as an attending or anything you think it should be different for a resident? And you'll be surprised. You'll hear something so unique sometimes from attending's perspective, which can help you decide as well when you're ranking all these programs after interview that, oh, they said this, make notes. And that can be helpful in future where you're deciding the ranking of where you want to rank a program. Tailor your questions towards the interviewer expertise. I already touched on that. Be mindful whom you're interviewing. We talked about this. If you're interviewing with the program director or associate program director, they do hold a lot of more decision making in that. It's not one person decision making, though. It's a full committee that decides a lot of things, and there's mostly internal ranking system and internal scoring system that they might be going through. But how you're interacting with program director, associate program director, coordinator, and the other residents is very important. They do come together after after interviews, and you may not be able to jump a lot of ranks. Let's say if you're ranked at number 12 and the program only has 4 seats, but you did so exceptional and with everyone in the interview that you made such a good impression that you might jump from that 12 to position 8 or 9. Not a huge jump, but still you'll be there. And if there's just 4 seats, you can imagine it goes down the list of how people have ranked you and how you have ranked a program. Additional thoughts about questions to consider. Think about mentorship. I used to ask about this in academic programs, if they provide specific mentorship to residents and how residents within themselves also have a mentorship program or not, if a senior is considered someone approachable for a junior resident. Clinical experiences, sometimes you'll see they'll mention community work on their website. Ask more in depth about it. I saw community work, that's an opportunity at your program. Tell me more about it. Some programs send send their residents or trainees to other countries actually for a month or so for some sort of cytology program or different field. So try to learn more about that if you have seen it on their website. Opportunities for research, teaching, and future future fellowships. All these are more in-depth questions after you have searched on their website, and you can say, oh, I saw on your website XYZ and I want to know more about it, instead of just saying, do you have a fellowship in transfusion medicine, because that's listed on their website already. Okay, so journal tips on crafting questions. You want to be genuine, you want to demonstrate some goals. Be be very specific sometimes. It's more for you as well. You want to know about the program, and stay positive. I'll tell you, when I was applying, I was actually more interested in pediatric pathology at that time. And there was a program where somebody said, well, we see you're more interested in pediatric pathology and you were talking about it too. We don't have that. So do you think you can still fit in our program? And I told him, I'm like, I'm ready for it because I know there's elective months, and I'm a very proactive person, and I think elective months would be good enough for me to find platforms, other places to cover that gap. And I'll join conferences, I'll join other societies to be up to date on that. But I do not think that's something that will hold me back from joining your program. So know what you're going to answer on things like, you know, what you have asked a question and they might counter back a question. Okay. So this is something just to think about, what you think is the aspect which is more challenging for you. There's no poll on that, but something to think about. Is it the behavioral question? Is it the clinical scenario question? Is it talking about your weakness that puts you in some sort of stress or anxiety? Or is it asking that question from an interviewer? What do you want to ask? So think of what you think is you feel challenging and start practicing on that now. Practice on that more than anything else. Coming to practicing. So this is a poll, and I wanted to see, let's see if I can jump to that poll. I wanted to see how many of you identify as English their first language, and how many of you think, yes, it's not your first language, but you do speak fluently or you're actively practicing on it. Okay, so a lot of people we have do not speak English as their first language, but they are fluent in it, which is really mostly the case with international medical graduates. I will tell you one thing. I used to say, and I still sometimes say, English is not my first language. And most of the time it's situational. You have to be very careful when you're saying English is not my first language, because if you're fluent in English, they feel you're fine, you know English. But it's only when you make grammatic mistake and somebody corrects you, that's when I say, oh, English is not my first language. That's why I made a grammatic mistake or a very simple, translational mistake. But other than that, if you're fluent in English, be confident and you'll be fine. You don't have to worry about it not being your first language, because if you have started practicing, you'll get comfortable with it. So if importance of practice, why it's very crucial. So one thing to note is that if English is not your first language, you may sometimes, or a lot of times, be translating from your native language to English, which can be very tricky if you're doing it in the moment in an interview. I would highly recommend not to do that. Start practicing early on so that you're thinking in English and responding in English to a point that it becomes natural. I have done some mock interviews where people have practiced so much, but they sound so robotic because they're sticking to a script, very specific, that they have wrote and practiced a lot, which is not bad, but then it takes away that natural or interactive aspect to it. It feels like, oh, they may be too cautious about what they're saying and how they're putting it, which you want to do, but very naturally. To I would suggest start practicing with a friend. You might feel more comfortable talking to a friend or a mentor, and you can sometimes even record yourself and listen back. I'll tell you, I did a clinical CS exam for USMLE. It's not done anymore, and I would say that was one of the highly stressful exam that I did because you have to pass in first attempt and you have to interact with real people who are there like a mock practice patient. So for me, I practiced to a point where even at home, I was saying, I understand. And my husband would be like, why are you responding to me like that? I'm like, this is just reflex. I'm doing it so much that my reflex is if somebody says something, I just say, I understand. And I sometimes would say, oh, tell me more about it. I'm like, oh, I just don't want to say it this way to my husband. It's more of like how I would say it to a patient. But I was practicing around that time with a lot of people online. You'll be surprised how many people you can find on online forums who would be ready to work with you because they're at the same stage or slightly behind or ahead of you in the same process. And everyone going through this process would understand what you're going through. Okay, so do practice a lot. I cannot stress more on that. How much practice can make you more natural and more confident in before you go into an interview. Okay. So some of the effective communication during interview, one, nonverbal communication. This is very difficult on Zoom, like making eye contact or maintaining good posture, using appropriate hand gesture. I move my hands a lot when I'm talking. On Zoom, it's fine. But when I did in-person interview, I would lock my hands and tell myself not to move my hands too much unless it's necessary. Or I would shake my leg in anxiety, and I practice not to do that when I'm an in-person interview. So on Zoom interview, it's very different, but be ready for, uh, how your how far your camera is and how you have put it together. Active listening. So if an interviewer asks you a question, listen very carefully. Pause and reflect before answering. You can rephrase the question so that you know you have understood the question correctly. Because the last thing you want to do is somebody says a question and then you start answering and you're completely off. And then the interviewer said, oh, that's also fine, but I was trying to ask you X, Y, Z. So it's okay to rephrase a question if it's a difficult question. Listen carefully what they are questioning about and pause and reflect before you answer. It's perfectly fine to talk slowly and speak clearly and at a moderate pace where anyone and everyone can understand you. Do not worry about accent. I have an accent very clearly, you all can tell, but focus on clarity. Focus on what you're trying to say. Are you able to communicate that very clearly to the other person and they understand what you're saying? And if you're unsure of a question, ask, this is also part of professionalism. We sometimes are hesitant on asking, oh, what did you ask? Sorry, can you please repeat your question? It's perfectly fine to say that because I might be asking a question that I can rephrase for you in a different angle. And that might be helpful for you and me to understand, okay, what we are trying to get an answer about. Okay, technology preparation before your interview. This is very important, especially even for virtual interviews. Be ready with your technology. Ensure that you have stable internet connection. Test your audio and video settings ahead of time. Keep a backup device and a hotspot in case you lose connectivity. Find a quiet, well-lit space for interview. Dress professionally and avoid distracting backgrounds. I would highly recommend all of you who are doing remote interviews to be ready with all of this because the last thing you want is technical difficulties happening in the last minute when you're actually interviewing, because then the interviewer would not be able to evaluate you. You will lose that time. And the other thing is also it's part of professionalism. They are giving you 30 minutes of their time from a busy schedule. You want to be prepared for that, okay? And it's important. It shows how important it is for you as much as it is for any other person. One time I had an interview with someone. It was job interview later on because that's when the remote interviews were happening. And I was on Zoom waiting for my interviewer to show up. But it was 15 minutes already into that time and nobody showed up. And I started writing email to that person. I'm like, I was supposed to do an interview with you. I think there might be some misunderstanding. I'm waiting. So I wanted to see if we are still on with the interview. And he forgot actually. And he replied me back, "Oh, I want to reschedule it. I'm completely forgot about it," which is fine, which happens. But that was a good experience where I was like, "Oh, if I would not have emailed him in the moment, even though it was like 15 minutes out, I could just have, exit out of that Zoom. I would never have had that interview with him. And my email to him just asking, or email to coordinator asking, "Oh, I had an interview with this faculty, but something happened." Even if it's a technical difficulty that's out of your hand, ask for a reschedule with that person. You might get another chance because they never got a chance to evaluate you. Okay. So building confidence and handling interview with stress. So everyone experiences that. And I think the best thing you can do is focus in the present moment. If you're interviewing with a program, just be mindful of the present moment, what you're doing right now. Be proud of it, be happy about it, because not everyone gets an interview. And if you have secured an interview, it's amazing. It's already, you're in the game. You won't be playing if you were not even invited for that interview. Preparation is the key. We already talked about that. Mock interviews can help you so much, even if you're doing it with family, even if you're doing it with friends. It helps you tweak your dialogue and tweak your story in the right direction if you start practicing early on. One thing to think about is positive self-talk. It helps a lot. I had times when I would feel, "Oh, I'm never gonna get a residency, and it's so hard in the United States, and I moved here, and now I'm jobless, and blah, blah, blah." So many things come to your mind. But my dad would always tell me, "But you did med school, and think about the 4 or 5 years of med school that you went through, that rigorous thing, and you did, all those exams, all those training, and you passed all that. You graduated from it, and it's in itself a huge achievement. And how far you have come so far from where you started off is very important to think. It gives you more confidence to thinking about your own story, how far you have come to. Pacing and pausing when you're talking, it's okay to take pause. It's okay to speak slowly, and you don't have to rush into answers. And then self-care. Get good sleep before the interview. It might be really hard for some people who are very anxious. Stay hydrated and stay active in the moment. Okay. Reflecting after an interview, follow-up. So a lot of times, I do take notes. When I was interviewing, I would take notes, and it helped me so much. I improved so much even throughout the interview season, where different questions from different responses that I was giving, I started changing my responses slightly based on those follow-up questions. So write notes for yourself, and it will help you improve based on your experience. Also, it may not be always possible, but it's something that's suggested that if you're interested in one program more than another, try schedule the program you're interested in towards the end of your interview season. That's by that time you're more comfortable with these interviews. Sending thank you notes. So I do get this question a lot, and I think in reality, it's very individualized decision if you want to send that thank you note or not. It has minimal impact on ranking, honestly. It will not change your ranking. It's not make or break factor. If you do send one, keep it very concise, sincere, and personal to avoid overwhelming somebody's inbox. We get a lot of email as attendings. And the last thing I would want a full note, which I'm not going to read. Probably I'm going to skim through it. But if it's something very specific, somebody is talking, "Oh, I had a really nice conversation with you about transfusion medicine," I might read it and feel good about it. But maybe I'm not part of the one. It's not going to change too much on the ranking list based on that. And two, it's very individualized. Some people like it, some people are okay about it. So it's up to you. Additional tools. So this is something that I learned in some of the leadership courses that I did. And it's very interesting because coming from Pakistan, I never knew there's things like these which exist online, which is free for everyone. So there's Myers-Briggs personality tests that you can take, and there's saboteur assessment tests that you can do online. And what it might give you is a self-awareness to improve on interview skills. It might help you understand yourself. And how is that? So the MBTI tells you if you're an introvert, extrovert, if you're a judging personality, or intuitive, if you're thinking or perceiving. And it helps you give the insight. Oh yeah, I am extrovert. I like to talk too much. I should be listening more carefully sometimes because I'm talking too much and over speaking on other people. Same goes for saboteurs. So saboteur is something where you would know what your saboteur is. And let's say this is an example of a saboteur. So saboteur is like, okay, this is something hyperachiever. I always say your weakness is something that can also be your strength. So hyperachiever, let's say when I got this for a friend and I said, but if you were not hyperachiever, how would you reach where you are? And she said, oh, maybe hyperachiever is a saboteur because in the moment, if I'm doing this with every single aspect, I'm overwhelming myself and I'm tired. And I'm like, yeah, that makes sense. If you're hyperachiever just in studies, that's fine. If you can limit it there, but if you're trying to be hyperachiever in every aspect of your life, you're gonna drain yourself. So think of what your saboteur is, see what the result. And I would say one thing, these results can change over a period of time. If you're taking a test or personality test now, 5 years down the road, it can change. And the other thing is, it's like a rapid fire round. Click what comes to your mind the first thing when you're doing these. And it's just for your own thing. Do go online and explore all the resources available. So this is a very nice paper that I read recently, and it talks about a lot of challenges for IMGs in PEDS residency. It was a really good insight reading this. AMA also has a lot of international medical education resources, which are free online, available for everyone, and those might be really good insight. Okay, so preparation, practice, and self-awareness are key for a successful interview. And I think it's a very stressful process for anyone to go through, and I wanted to wish everyone best of luck for that, and we can take some questions. This is a quick feedback that I would really appreciate from you all, if I can get that, to improve for future and see how we want to do differently or the same in future. So we can take some questions.
Hi, Dr. Asif. Thank you so much for this informative session. It was amazing, and we really all appreciate your time and efforts. My name is Iman Al-Haddad, and I had a quick question, two questions, if you don't mind. The first one is, during an interview, if we had previous research that was published, would it be acceptable to have copies of those next to us and refer to them if we're asked, especially when like we know the gist of obviously the research we were involved in, but like when it comes to specific genes or things that are hard to memorize in a situation of an interview, to refer to it as we're speaking about it, or would that be perceived as unprofessional?
Most of the time, they're just trying to get a gist of it. They're not going to go in very detail unless you're talking to someone who's also expert in that. You can have those, if you're doing a remote interview, it's different. You can have those references available with you and refer to them. And it should be fine. If someone is telling me, I would feel, oh, they're so prepared about what they have published on that they want to just look at it right now. And they'll be like, oh, I have my paper and I can tell you, and this is a very good question and things like that. But if you're doing in-person interview, it might be very tricky to take those papers with you and then open them right in the interview. So
Okay.
most of the time they're looking for a gist of what you have done.
Perfect. Thank you so much. And then my second question is, when we are receiving interview invitations, should we be sending a thank you like before the interview, like thank you for choosing me for an interview, or is that just gonna clog up emails and it's not worth doing?
I think they're not expecting that. They're expecting you to respond with acceptance or not. So this is more critical if you get an interview invite. Right now, I'm doing a course for medical students, and I got an email that medical students might have to step out to respond to an interview because it's first come, first serve basis for a lot of programs. So all you need to do is just respond whatever they're asking to respond to say if you're going to interview or not. Sending a thank you before the interview for an invitation won't change anything.
Okay, perfect. Thank you so much again for your time, and I really appreciate this. It was so informative. And I hope you have a wonderful day.
You're most welcome. I do see in the chat, I want to ask you a specific question when you do have the argument or disagree with your colleague. Should you speak first with the chief or resident? Chief of resident. Yes, I think one thing, it depends on the situation. So let's say if you have a disagreement with your colleague in a team, I would first try to understand where that person is coming from, one-on-one with that person, because they may not feel comfortable if you take it to a high level right away. So talking to that person would be more important than taking it to high level or accelerating something. Okay. You might be able to understand more, and it's okay to disagree, like agree to disagree sometimes. It's like, oh, okay, you're coming from different aspect and I'm coming from different aspect. But if it's not affecting patient care or your own mental health or their mental health, it should be fine. But escalating something to a high level, you have to be very careful before you do that and think of the situation. Think of, tell that person, take them into trust as well. Talk to them and say, maybe we should take this to chief resident and discuss with them, okay? Instead of just going yourself to chief resident. So that's my advice on that. Okay, any additional questions? All right. Thank you all for taking time and joining today. I had such a good time talking, and I have shared my email. Feel free to email me with any follow-up questions if you may have. I may not be the most efficient in responding right away. One thing, if you are emailing someone in US, be mindful of the time zone. Sometimes you're on the East Coast and you're emailing someone on the West Coast, and it might be already a very different time zone that they're in. So emailing after 5 or 6 p.m. may not be considered professional, something to note. All right, thank you all.